Prostate Cancer, a Matter of Facts on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. We have time for one more viewer question. Dr. Drabek, the idea of having surgery in that part of my body scares me because of potential side effects. Is radiation or chemotherapy a good option to treat my cancer?
It's natural to feel anxiety over such a big decision, and for localized early-stage prostate cancer, radiation therapy and surgery are generally considered equivalent. They each have their pros and their cons, their disadvantages or advantages. They need to be discussed at length between the patient and his doctor so they can make a rational decision what's best for him. Chemotherapy has no role for early-stage prostate cancer. It's usually utilized in patients with metastatic disease that's advanced.
Okay, Dr. Drabek, thank you for answering our questions, and we want to thank all of the medical experts here tonight for answering your questions as well. And we'll send it back to you in the studio, Chuck.
Thank you, Deborah. And those phones will remain open until 8 o'clock. And joining us now is Dr. Justin Giuliano, radiation oncologist. Now, you're talking about intensity modulated radiation therapy. That's a mouthful. What's that mean?
Well, intensity modulated radiation therapy, also referred to as IMRT, refers to a technology that incorporates advancements in both the planning as well as the treatment delivery of radiation. With respect to prostate cancer, IMRT has allowed us as radiation oncologists to escalate the dose to the prostate gland while minimizing dose to the surrounding normal structures with improved patient outcomes.
Okay, now, is this therapy, is that a treatment for all prostate patients?
Yeah, IMRT is an option among many, as we've heard, available to patients with very few exceptions who indeed have clinically localized prostate cancer. That said, there are some patients with locally advanced prostate cancer in selected cases who may be eligible, as well as patients who have already previously undergone a radical prostatectomy.
Well, how does this type of treatment work?
Essentially, what happens is we have a machine called a linear accelerator that has sophisticated components to it that allow for varying both the intensity of the beam as well as the shape of the beam as it exits the head of the machine. At Hershey Medical Center, we have state-of-the-art rapid arc therapy, and rapid arc therapy refers to a continuous arc that's made by the machine around the patient, and throughout the course of that arc, we're able to modulate the beam intensity and dose rate, as well as the speed of the machine and the opening of the treatment aperture. Thus, we're able to tailor the dose around the prostate gland, as well as increase patient treatment time, or increase patient throughput.
Very quickly, what about side effects? That's what the man wants to know.
Yeah, so basically it comes down to the bladder, the rectum, as well as the erectile function. So we do cause, in some cases, urinary bother, rectal bother, and in a delayed sense, some men do experience a decline in their sexual function. However, that said, the majority of patients actually do quite well with very few side effects.
Good. It's good to hear. Thank you, Dr. Giuliano,
thank you.
and thank you for joining us here tonight. And thank you to all our viewers out there for sharing your stories and sending in your questions. If you'd like more information or you'd like to schedule an appointment at the Penn State Hershey Cancer Institute, call 717-531-8848 and then press option 3 or visit them online. Thank you again for watching tonight, and of course we wish you all good health. Thanks again for calling in. Take care.